Dr. Dina Badawy. Dr. Dina is an administrator of pathology at Faculty of Medicine, Oxford University, and also pathology registrar at Sheffield Orman Hospital.
Thank you, Dr. Muhammad, for your great efforts on this day and for your nomination of me to be here today presenting my case on the International Pathology Day. I'm Dr. Dina Badawy. Said. I'm a teaching assistant at Luxor University and a pathology registrar at Sheffield Orman Hospital. Today, I'm presenting my case under supervision of Dr. Angel Hariri, a pathology consultant at Sheffield Orman, who I'm very thankful for her precious advices and guidance. My case entitled, It is Zaleo, Beware. Actually, our case is quite interesting, and I hope it will evoke some interest for you all. Okay, we can start again. Our case is a male patient, 40 years old, presented in Sheffield Orman Hospital since 2022 by multiple progressively enlarging basal right lung nodules. His CT chest showed right pulmonary nodules. The largest nodule was 14 millimeter, apart from his unremarkable CT abdomen and the pelvis. A true cut biopsy was requested from the lung mass, and it was submitted in our labs in Sheffield Hospital. And it revealed the lung tissues infiltrated by highly malignant epithelioid cell neoplasm, arranged in solid nests and separate cells. On this magnification, we can see the malignant cells showing abundant eosinophilic cytoplasm with focal clearing, marked polymorphism, frequent mitosis. Based on this morphology, we have a malignant epithelioid neoplasm, either a carcinoma or an epithelioid sarcoma. So we requested immunohistochemistry panel for the lung mass. We requested cytokeratin to confirm our suspicious. Cytokeratin was strongly positive, which guide us to the epithelioid nature of the lesion. But cytokeratin was strongly positive in a focal pattern, which is not a pattern of carcinoma. So epithelioid sarcoma was on the top of the differential diagnosis. We stepped back and revised the clinical history and the archiving files of the patient. We find out that he had history of ocular exenteration for right eyelid mass since outside Sheffield Orman Hospital since 2021. Slight revision of the eyelid mass was requested, and it revealed the intact skin with underlying infiltration by a highly cellular tumor tissue formed of sheets of large spindle cells as well as few epithelioid cells. And on this power, we can see large vesicular nuclei, prominent nucleoli. Anaplasia is marked and mitosis is present with abnormal bizarre forms. This case was diagnosed outside Sheffield Orman Hospital as ocular melanoma without evident immunohistochemistry panel. So we requested immunohistochemistry panel for the eyelid mass to exclude the diagnosis of ocular melanoma. We requested Milan A, HMB45, and they were negative. So in concordance, in the following immunohistochemistry panel was requested, it was positive for H-caldesmin and SMA. Ki-67 was 40%. We can summarize here the immunohistochemistry panel. SMA, desmin, and H-caldesmin were positive. Ki-67 was 40%. HMB45, Milan A, SOX10 S100, CD31, ERG, and cytokeratin were negative. So our diagnosis here is epithelioid leiomyosarcoma of the eyelid. Back to the lung mass biopsy, and after correlation with the clinical history and the morphological findings, we proceeded with the immunohistochemistry panel for the lung mass biopsy. It was focal positive for H. caldesmin, focal positive for SMA, and weak focal positive for desmin. S100 was negative. So we have SMA, desmin, and H. caldesmin were positive. Cytokeratin was positive, as we mentioned in the previous slide. S100 was done, and it was negative. We came to our final diagnosis, which is metastatic epithelioid leiomyosarcoma to the lung of primary eyelid origin. About eyelid leiomyosarcoma in brief, it is a very rare tumor with only few very cases reported in the literature. Leiomyosarcoma of the eyelid can be primary, secondary, or metastatic. Ocular and or orbital leiomyosarcoma can arise as a primary tumor from the vascular or sympathetic smooth muscle, occur secondary to radiation therapy, metastasize from distant sites, or extend from paranasal sinuses. Thank you for your attention, and happy International Pathology Day.
Thank you, Dr. Dina. Thank you for your interesting presentation. Thank you for your great efforts.